So when I was little, I didn't know I wanted to be a doctor. I actually wanted to work in the toy aisle at Kmart or something. But my father was a physician or is a physician, and I got to go to work with him when I was little, and he would give me tasks to do, and I thought it was, pretty cool. And I just really enjoyed seeing what he was doing, and he would tell me that this is one of the most important jobs. It's such a privilege to get to take care of people, and there's no job like it in the world. I did my training here. I was fortunate enough to get to do my fellowship in plastic surgery at the Crystal Clinic, and I think what I saw here really impressed me, the quality of the physicians, the nurses, the staff, and that definitely left an impression on me. In particular, the patients I would take care of would tell me how pleased they were with the care they're receiving, and I thought that's probably the most important thing. If the patients are happy with the care they're receiving, that's where I want to work. What I really love about our field is that it's a very diverse and challenging field. Plastic and reconstructive surgery has a lot of difficult problems to try and fix. And I think what makes me proud is that we're often given these difficult situations that sometimes our colleagues send to us and ask us for help, and we kind of have to think outside of the box. And it can sometimes be frustrating because the solution's not always that obvious, but it's also what makes it exciting and fun and challenging. I like spending time with my family. We get together a lot for cookouts. I love to cook. I don't know if I'm a good cook or not. My husband eats everything I make, so it must not be that bad. My husband and I love to travel, experience new places, new cultures. And when we're staying at home, there's nothing better than sitting on the couch and binge watching a good TV show. Probably the aspect that I love the most is the relationship I get to have with my patients outside of the operating room. So I get to hear these stories from my patients, and I get to know them from the beginning of the process when they come in to see me for consultation to the end after surgery when they're healed. And I think getting to travel with them along that journey is probably the most rewarding. Seeing them thankful and happy when they're healed is one of the best parts about being a doctor.